to LOA Today. I'm Walt Thiessen.
With me today is life coach and LOA teacher Joel Elston.
This is your daily dose of happy. We are so happy you decided to join us today.
Joel, I had a couple of incidents last week that led to me deciding, okay, this is the topic for Joel and me to talk about today. And I was telling you one just now, and I'll get back to it in a moment and tell the audience too. But I also want to tell you the other story because I think it's a good way to kind of start the conversation. I think, for the last 9 months, I've been seeing a physical therapist because of a neuropathy I have in my Achilles, and she's making some good progress with me. She's great. I love her. She's a fabulous doctor. She really knows her stuff. And I think probably I'm like a month or two away from being done with the therapy. I'm getting really close. So I'm excited about that. That's good. But she said something the last visit, which kind of got my attention. And if I didn't like her so much, I probably would have said something. But I like her tremendously, so I didn't want to say anything. But she said something that actually gets said a lot. And I thought it's a good basis for a conversation because I think it's actually very inaccurate. What she said was people shouldn't medically self-treat themselves. They should rely on their doctor for that. And as soon as I heard that, the first thought that went through my mind was, I don't trust most doctors to make those decisions for me. I want to be the one to make those decisions. And it also occurred to me, well, we talk a lot here on the show about what we often call radical responsibility. I take responsibility for everything going on in my life.
Sure.
So to me, this is an extension of that.
Right.
Just I'm responsible for my own health. Yes, I will confer with the doctor, sure, because they've got medical knowledge I don't have. But I'm not going to wait for a doctor to decide what I need to do. I'm going to do my own stuff. And and her whole point was, if you try to self-treat, you could end up doing the wrong thing. You can end up basically going in the wrong direction, maybe even harming yourself by accident. And I understand the motivation behind that statement, but it occurred to me, it's completely wrong. And the reason it's completely wrong is we can't learn without making mistakes. Doctors can't learn without making mistakes. No one can learn without making mistakes. You have to be willing to risk making mistakes. Now, again, does that mean you should try to do things without a doctor? No. I mean, certainly that you want to use resources that are available to you, but you have to be willing to risk making a mistake. You just try to keep your mistakes small. You don't want to make the big mistakes, right?
Right.
And I realized this is kind of like a core piece of what you and I were talking about before the show. Why the medical system today is in many ways quite broken. At least I think that's our opinion on it.
Yeah, I agree. And not in defense of what she's saying, but since she went to school for her career, and what she's repeating is years of education. She's repeating that almost like, if I don't say this, I can be held liable kind of. So much of medicine is built out of fear of being sued. And so you'll get these responses like when we did this show on psilocybin, and probably 7 times throughout the show, we did a disclaimer about we're not recommending this. We're not. And first of all, we're not. And second, there's also a concept that if people perceive I said something like you need to go try this and something goes wrong, there would be a potential liability case on that. And so you have to. So a lot of times, most medical stuff is said to protect, and they always go with what the AMA recommendations. One of the things that I was always fascinated about, and I know we're going to get into this story, not only to cut you off, but when I was in my, younger, 30-ish, early, right around there, had a checkup, and my blood pressure has always run about 125 to 130 over 80. It's always that. It's been that way since I've been a kid. And when I was 20, that's a good blood pressure. Everybody said, "Oh, you got really good blood pressure."
Sure.
Well, when I got 30, they said, "Well, the recommendations have changed, and it's slightly high." I go, "But it was good 10 years ago, but the same number is not good now." And right now, my blood pressure is 130 over 80, and every time I get my blood pressure taken, Well, it's a little high. I go, but it's been that way for my entire life. And,
Mhm.
I lift a lot of weight. So a lot of this concept is, if I need a blood pressure medicine, I'll take it. But you start down a path, if you take blood pressure medication, there can be side effects from that.
Oh,
I
yeah.
have, I have because I've lifted weights and so I have a resting heart rate of about 55. So it's nice and boom, 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 solid heart rate. Well, certain blood pressures like beta blockers lower your heart rate.
Mhm.
Well, the last thing I need is my heart rate to get down to 40.
Yeah, I hear you.
It's just, yeah, because so the idea that if you're going to medicate my blood pressure, you're going to medicate my heart rate because they usually sort of go together. And I can't afford that to be down there at 40. In fact, when I was in the hospital one time for surgery, and you have to sleep overnight, the alarm kept going off because in my sleep it would dip down to 48. And finally the doctor said, turn it off. He's fine.
Mhm.
But the idea, so medicine today is not built on individual diagnosis and bioindividuality. It's basically this broad spectrum of just information. I am in fact, at the doctor, I get a report every time I go. I laugh at it. My body mass index suggests I am obese. It says you're obese. I get a sign that says, Joel, you're obese. Yeah, thank you. But no, I'm a weightlifter. I have a lot of mass. Arnold Schwarzenegger would be obese at his peak of his career.
Mhm.
He's running about 6% body fat. But so my whole point behind it all is medicine is all about the middle. It's not about the individual. It's not about going and learning about you. That's why I'm very much a believer in when you need Western medicine, traditional medicine. I'm glad we have it. It's if you need it, you need it. But also open to the concept of the origins of why your blood pressure is high, or the origins of these things. There's a lack of that understanding because when you go check those things out, they're just going to say, "Oh yeah, well this," with no knowing of understanding why, and that's the problem.
Yeah, and I've actually been delving into a lot of this stuff. By the way, I mentioned this in a previous show last week, but I'm going to say it again. I'm loving artificial intelligence.
Oh
I've been
yeah, I
messing
do
around
too.
with Google's Gemini, which is their new
Yeah.
version, and I mean, I am learning so much by using
Oh
these.
yeah.
But among other things, I've been doing some research into what we know, what is actually known about medicine, because these AIs they're connected into the entire database of the world. So I mean, you got all of the internet, at your fingertips in a sense, with this
Sure.
intelligence software summarizing it and giving you here's what it all adds up to. And I learned a few things. One of the things that I learned is that we were talking about blood pressure, right? In fact, I'll be telling a blood pressure story in a moment. Everybody, I think, is aware of all the different things that modern medicine tells us about blood pressure. High blood pressure, the higher it is, the more risk you are of stroke and heart attack and so forth. One of the things they really pay a lot of attention to is LDL cholesterol, what they call the so-called bad cholesterol. You want to have that within a certain range. You don't want to have it too high because then your risk of stroke is higher, your risk of heart attack is higher. And so that's where a lot of the medicine is all about, trying to keep people on these statins in order to keep the LDL down and so forth. But there are a few things that they leave out. They don't really tell you about these other things. For instance, you probably know this, but I imagine many of our listeners don't know. LDL cholesterol is actually one of the most valuable things we have in our body.
Absolutely. Your brain uses it for uh, the chemicals in the brain. That your brain is basically made up of LDL,
Yeah.
the tissue in your brain. Cholesterol is a necessary functioning of hormones for the body. It is a chemical that is used for all the production of the chemicals in the body.
In fact, LDL cholesterol is the very first element involved in creating hormones.
Yes, absolutely.
With the so-called bad cholesterol, if you didn't have enough bad cholesterol, your body would not be able to produce hormones at all. It'd be impossible.
It is necessary, and the concept that you're going to use a statin and strip all the all the LDL out. And there's a lot of doctors that actually just say, look, we're missing the whole point. A lot of doctors believe a lot of sugar creates inflammation, which makes the LDL get stuck in the veins, in the arteries. Is that's more the problem than the LDL. And the cholesterol, statin medicines can drastically lower your LDL.
Oh, yeah.
But we also don't see a direct connection between lower LDL and a less heart attacks. That's the piece that I find amazing. Yeah. There's no connection. It's sort of like when we look at an antidepressant like Prozac. It's basically increasing your serotonin, and that sounds like a really good idea.
Sure.
But there's never been a real, there's a few people, I'm sure, as everything, that lack of serotonin is certainly a factor in depression for many people, or a few people, or a certain percentage of the people. However, most depression is not they don't, by the way, they have no way of measuring a lack of serotonin. They just simply say, you get a lack of serotonin, probably, maybe, and here's a drug that'll fix that. But when you have somebody that loses a child, loses a parent, is in extreme loss of job, life satisfaction, you are depressed, and that is a natural reaction to loss, or in any kind of situation, a bad situation. Carl Jung, famous psychiatrist, he never really believed in the depression model. He just basically said people that are capable of living way up here and are living way down here, the space in between is depression. That's what he said that for years about. And I'm not saying, I am always open to the idea that there are people that lack serotonin for whatever reason.
Yeah.
So, but the idea that that's your first shot, you go see your family doctor, I'm feeling a little down, doc. Well, here's some serotonin. That'll help. And it's just an absurd concept that was derived because psychiatrists, and I have some dear friends that are psychiatrists and probably don't listen to me because they think I'm crazy. But I was at dinner one time with a couple of friends. One of them's a psychiatrist, one of them's a neurologist, and we were having a conversation. The psychiatrist was very proud. He was so excited. He said, from 11 a.m. to noon today, I saw 7 patients. I said, what? I saw 7 patients. Now, what he was bragging about is he's billing insurance $200. He made $1,400 in an hour.
Right.
He was super excited about that. Now, again, is that the best quality of care, standard of care? I grabbed 7 patients. My dear friend and mentor, who was Dr. Sherman Master, was probably the last psychiatrist on a full hour of therapy before he prescribed anything. One full hour at least. And then he would prescribe if he felt it was necessary. That's not the case. And same thing with medicine across the board has gotten, let's give them a medicine, send them home and check back in a couple of weeks and see if you're better.
By the way, you mentioned also with LDL cholesterol, you mentioned how the tissue of the brain, the fatty tissue of the brain is built from LDL cholesterol, which is true. Interesting little side note, if you don't have enough of that, that's where Alzheimer's comes in.
Absolutely.
They seem to leave that part out. I don't know how that gets left out of the conversation, but they do.
Well, to be fair, it's a factor in some cases of Alzheimer's. There's again, that's another name of something. There's multiple things causes that. But I certainly agree. Yes, the stripping of your LDL, a necessary nutrient, a necessary nutrient for the body. Cholesterol is a nutrient, the most basic nutrient. It's really frustrating when people somehow, that's been vilified. You remember when eggs were bad for you?
Oh yeah, I remember that.
Yeah, but they're good for you, then they're bad for you. I think we're on the good for you track, but soon, but they're going to be bad for you again. I promise you they're going to be bad for you again. So,
well, forewarned is forearmed. So thank you for that.
I've never stopped eating eggs, but they've been good and bad. Yeah.
But anyway, I wanted to tell you the other story about what happened. Because that meeting with my physical therapist was on Wednesday. On Thursday, now I've been dealing with elevated blood pressure
which for me is more in the range of what you're like. You were describing, 125 over 80. For me, that's elevated. My history has always been what would most people be calling low blood pressure, 90 over 60, 100 over 70. That was my very typical range. So when I got up into that range that you're in, I felt a big difference. And it's a difference that most people wouldn't even notice, but I would notice because it's not my norm.
Right.
It's not normal for me. So I was really feeling it. So I was paying attention. There were even some days where I get up to like 135, 140, like, oh, this isn't feeling good at all. What's going on here? So I did some research, but I also kind of fell into, well, this is what medical science says. Check your sodium levels. So I checked my sodium levels, and you know what? They were ridiculous. I mean, I was taking like 4,000 milligrams a day. I was like, well, okay, all right, now that's over. That's really too much. I got to cut that back. So I did. What I didn't realize is I cut it back too much. And on Thursday, I ended up in the ER because my blood pressure was through the roof for me. Now, apparently, what I learned through that visit, for me, through the roof was like 160 over 90. That's like so much higher than anything I normally have that I felt horrible. I felt really, really terrible. What I learned is that unless you have also some, heart pains going on or something like that, that's not even considered an emergency. You got to be up to around 200 over 100 with no other symptoms before they consider that to be an emergency. I didn't know that. But I went through that experience. Incidentally, I also encountered, there were 3 doctors who were seeing me. And one of them, they were nice about it, but they're kind of ridiculing me for getting all excited about 160 over 90. And one of them said, I'm 65, which is a year younger than me. He says, I'm probably 160 over 90 right now, so we should probably swap places because I should be in that chair. And all I could think was, you want me to trust you with taking care of me medically when you can't even take care of yourself? That's all I could think of. Now, maybe that's a little bit unfair, but I also did some research after that. You know that 24% of all medical doctors are obese?
Wow.
24%. Now, that's less than the population as a whole. The population as a whole is about 40%. But that means 1 out of every 4 doctors is severely overweight.
Well, to be fair, so am I.
From somebody like that, I don't understand that.
Yeah, I agree. I mean, it's terrible. It's when I get on a tangent on that alone, but you're right. I'll let you continue.
Yeah. Well, anyway, so I went home after that, feeling a little bit better. I mean, I wasn't feeling great. I was still feeling pretty miserable, but at least I felt like, okay, I'm not in danger. That's good. All right. So I went home and I'm thinking, why is this happening? I mean, they're clearly not going to help me. They don't have any clue what's going on. They're not going to ask me the right questions or whatever. They certainly weren't interested in the fact that it was abnormal for me. It was normal for the population, especially. I got the lecture about, well, when you're in your 60s, you can't play football anymore like when you were in your 20s. So you got to expect that things like this are going to happen. And I'm thinking to myself, are you kidding me? You're equating what for me is a rise in blood pressure to playing football like a 20-year-old? Are you absolutely kidding me? But apparently they were. Anyway, I digress. Let's get back to the main thing I was talking about, which is, so what's actually going on here? I had to do the one thing that my other doctor said you shouldn't do. I had to start self-diagnosing. I had to start figuring it out because the medical establishment wasn't going to figure it out. And it finally occurred to me, I wonder if I'm taking too little sodium in. And so I did a little research on that thought. And sure enough, there actually is medical research that shows if you have too little sodium, your blood pressure can go up. I said, oh. So for the next couple of days, I made sure I was very careful about my diet. I measured it all out, put it into a spreadsheet so I could calculate to see exactly how much sodium I was taking in. So I would get it between 1,500 and 2,300 milligrams, 2,300 being what they recommend for the average male and 1,500 for an older male. So I figured somewhere in that range, that's probably going to be the good place to aim at. So, and I aimed it more toward the 2,300. And I did that for 2 days. In 2 days, the blood pressure came down as low as 100 over 55, which for a lot of people, that's scary. For me, that's actually normal. But I was like, whoa, it worked. Oh my goodness. My blood pressure is back to where it's always been. Now it hasn't stayed there. It popped up a little bit since then. But the point is, it stayed down where it needs to be. And all because I didn't realize I had overdone it in terms of reducing sodium. We really do need sodium.
Of course, another necessary, you would die without sodium.
But you wouldn't know it by listening to the medical establishment.
because they choose that. It's like one of the more bizarre things that knowing my bio individual mechanism in play, my body temperature, if I go get the thermometer right now, is going to be about 97.1. That's
My God, it's
every day.
amazing you're alive.
Yeah. 97.1. It's always been low. It's always been, runs off. So if I'm feeling bad, and again, I know there's something going on, and I never get sick. So I know there's something. If I'm 98.6 or 99, okay, I got a little something going on. But if I tell a doctor that, they go, Joel, we don't even count that as a fever. Well,
Right.
You don't understand. I start and said, well, that, blah, 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 blah.
Right.
So the problem that we're talking about is medicine has lost the ability to treat the individual. It treats it treats the middle. It treats the norm. It treats this is the medium. Yeah, and it's treating that, and it doesn't look at the individual goes this way. Your body operates on blood pressure. For me, I'd just probably pass out. It'd be so low. Yeah, but I have this, my energy. It's always that. It's again, my entire life has been 130/80. I don't get sick. I'm a competitive power lifter. I lift a ton of weight still, and I've had a cuff on me one time. This guy wanted to test it. I did a deadlift of 400 pounds while a blood pressure cuff was on, just to see what it would go. My blood pressure went up to 237/145.
Wow.
Yeah. Yeah.
Wow.
So I mean, but that's on a 400-pound deadlift. So that sort of makes sense.
Sure. Yeah.
Yeah,
I mean, if I ran up in 20 flights of stairs, I'd probably have something similar.
Yeah. So, but where medicine disappoints me is the lack of everything's a puzzle to me. So when somebody comes to me, and a lot of doctors will send me people that I'm not a medical doctor, but they know that I'll do these deep dives on things, and so I had a client one time. His behavior was way off. He was, and everybody, he went to see a psychiatrist. They gave him all the meds, nothing worked, and so we just started doing of any possible thing. What is it? What are we doing? So I mentioned the word Lyme disease, and I said, has he been tested for that? And the response was, well, he's not been in the woods. He hadn't been around the ticks, so we didn't test for it. So, and of course, I said, so, I wanted to do a vitamin D test. I wanted to do a magnesium, a mineral test. So I said, why don't you throw a Lyme disease test in there for me, just for fun? Just, that's a hobby of mine. And they laughed and came back. Sure enough, he has Lyme disease. And it's been there a while. It's affected his brain. I mean, fortunately, he's fine now.
Wow.
But the concept was, and so you have all of this as a puzzle based in the medical profession wants you in and out, and here's the median. So everybody's supposed to be this, and that's the problem. That's what, and it needs to be quick. And as I mentioned, I think before the show, I don't think I said this during the show, their goal is to get you in to tell you, here, either do this or take this pill, and then come back if there's a problem. They almost like get you in and then tell you if it doesn't get better, come back. So they're totally dismissing you from the beginning.
Right. Exactly. Interesting too. You mentioned earlier how the medical establishment is kind of locked into this pattern. Like you mentioned, my physical therapist was basically responding to what she'd been educated on over and over again, and that it's ubiquitous. It's like throughout the entire industry. It's like there's a thought process everybody is supposed to follow.
Yes.
And following up on that concept, I very recently, I told you I've been enjoying playing with AI. I asked my AI Gemini one time, I said, if there was a mythological character that would be representative of the modern mainstream medicine, what would it be? And it came back with a name of a series of letters by Jeremy Bentham, the philosopher.
Wow.
And the name of the letters was Panopticon. Panopticon was his ideal prison.
He was trying to deal with the question of how do you reform prisons in the 1700s, the 18th century.
Yeah.
And his idea was what you need to do is you need to structure a prison so that the people running the prison can influence the prisoners to identify and to adapt to better behavior patterns. And you do that by giving them access, giving the overlords access to see everything that's going on, and then they can do things to influence the culture of it. They can put people to work to do certain kinds of tasks and so forth. And in fact, what he outlined was so intriguing to the people not only of his time but of the next generations that they created a system like this in Britain in the 19th century, which we now know of as the workhouses. The workhouses, except for the architecture, the workhouses were basically Bentham's panopticon. And we now know historically that the workhouses were about the worst thing that could possibly have been created, because what they really ended up doing was turning impoverished people into a more impoverished people who were also more sick and ready to die in their prison / workhouse and so forth. It was truly a horrible specter. So I was intrigued that the AI had given me this as an equivalent, right? And I thought about it some more, and I realized there's a lot of truth to it, because mainstream medicine is all about modeling, kind of molding their entire population to all think the same way, and thereby also molding the entire population of the planet to all think the same way. And that's exactly what they've accomplished. In the ideal philosophical position, they say, well, that's a good thing, because this means we have accomplished the goal of creating a system of thought that everybody adheres to. So we have a regularity, we have predictability, we have continuity, we have consistency within the medical establishment. And yet here you and I are talking about all the different ways the system is broken. Mm-hmm. And I would submit that what they were trying to do exactly in and of itself is why it's broken.
Well, I completely
when you try to make everybody think the same way, you break things.
Well, and when you operate on the premise that everybody is the same, and you're going to find everybody should think the same, that's where it becomes really bizarre. Like,
oh yeah,
I know some people, and this is I know some people that thrive on eating a vegetarian or vegan diet.
Sure.
It's really good for them. I ate one for about a week and felt the absolute. I've never felt so bad. I mean, yeah. It's terrible. It's just for me, it's terrible. And what my research on all things has always been, it always comes back to what is your unique you, no matter what it is.
Right.
I have a different skill set than you. You have a different skill set than me. I have ADHD. I'm a very, as everyone, we're all very unique in all of this stuff, the nuances that make us all. And that doesn't fly with what they want it to be. And so many of my friends are doctors, so I'm not saying these individuals are out to do a bad thing. They really believe in what they're doing. They believe sincerely what they're doing, and they help a lot of people.
Sure.
But the idea that if you bring a pharmacy, if you're a doctor, the pharmacy is the toolkit. If you're a surgeon, the scalpel is a toolkit. If you're a chiropractor, the adjustments on the back, and if you're acupuncturist, your toolkit is influenced by what your training is. So again, instead of like, what does this person need? The assumption is, well, this person needs me, and he needs surgery because I'm a surgeon. And that's where all of this gets lost. And having, I have some clients that I help manage this stuff. Again, I'm not playing the role of medical doctor, but Dr. Mark Hyman has called Function. It's called Functional or something like that. It's for $499. You get over 100 blood tests done, and they some of the tests they do twice a year, but year over year you track these very nuanced blood tests.
Yeah,
I use that for my clients regularly, and we have uncovered a lot of things by these tiny little things that most doctors would never order. The basic,
Right.
the basic 30 function, the 30 panel blood test is for liver, your kidney function, your cholesterol, blood count, all that other stuff is all necessary. But there's 70 other things, and there's more. But if we need to do more, we can. So the idea of finding out what makes you function and how you respond. We all have various food sensitivities, whether you realize it or not. There's some foods that agree with, some don't. Some of them could be extreme allergies, as you know. Others could just be, every time I eat that, like, whatever. I know some things that I can't eat a lot of that I'm not allergic to it, but my body doesn't respond well to it. And most, like there are some people that like they have a gluten sensitivity. They don't have celiac disease, but they're very sensitive to gluten. Well, I know a lot of doctors that roll their eyes at that, saying, "God, they're just hypochondriacs." Well, it's just you're making assumptions, and they want the norm. And one of my things about, and I tell all my doctor friends, back to my mentor, Dr. Master, the reason that we hit it off immediately is I met him when I came up to Virginia to interview for director job at that treatment center we both worked at.
Right.
And he interviewed me, and he was one of the people who interviewed me, and we had a good talk. And he said something that I never heard a doctor say before, and it was so fascinating to hear a doctor say this. He said, "I don't know."
Wow.
And I fell in love with him. I said, what do you mean you don't know? You're like this. He goes, "You know more about this than I do. This is your field of expertise." I'm going, "Well, I've never heard a doctor say that." Because you go ask a doctor if they know it or not, they're going to give you an answer. It's just that the vocabulary of "I don't know" is not in many doctors' wheelhouse. So, so having the ability to admit, "Hey, I don't really know what this is," and I like to. And if you're approaching every patient like they did you, here's what these doctors did. They saw you. They rolled their eyes. Okay, here's this dude. He's 66. He's got elevated blood pressure. He thinks he's all like they just made an assumption right off the bat. They did. They painted you as this like hypochondriac. You're worried about this just normal, and no further discussion of that. Yep. And if your blood pressure is historically 110/70 or whatever it was. And it goes up to that number, I have a concern of why. That's all I want to know. Why?
Yeah. And it turned out there was a very real reason why. They just
look
into it.
They were looking into it. So I want an origin to why. And once I know why, it's going to be, then we work on it. But there was going to be no in-depth. They're just basically saying, "Look, dude, you're old. This is what happens. You got to just accept that." And, I had a discussion with my last insurance company required me to have a physical every year. It was really annoying. And so it was never with the same doctor. It was just this random thing they would do.
Right.
And so I would explain, I lift weights, and he goes, "Oh, okay, well, that's good." And I said, "But no, I really lift weights. I'm a power lifter." And I said, "I could deadlift 500 pounds. He goes, "No, you can't." And I said, I really can. And we had this back and forth. And he goes, "Well, it's not healthy for you to do that." I said, I'm just telling you. And the reason I was telling him is this is another example of this. The liver enzymes represented by the initials AST and ALT, when they're elevated, that they can indicate you have a liver problem. Those enzymes exist strongly in the liver, but they are also in every muscle in your body. So if you go work out, like I work out, those enzymes are released for about 24 hours. They measure for about 24 hours after workout. So when they draw my blood and my liver enzymes are slightly elevated, they're not liver enzymes. These are enzymes that exist in the liver as well as muscle. I explained that to him, and he goes, "I've never heard that." I said, "Well, I'll send you an article. How about that?" But that's I lift weights, I damage my muscles. I don't have a liver problem. I know that because I've had, every time I lift weights, it seems elevated. They eventually did a scan of and everything's perfectly fine. It's functioning perfect. It's just this concept that we're talking about, that you're not the norm, and it's where a doctor goes, well, you can't deadlift. I'm like, I showed him a video. Here's 500 pounds. Here's me deadlifting it.
And I've seen you doing that. Like, wow.
Yeah.
I look at that and I say, how the hell does he do that?
Yeah. Well, for 40 years, you do the same thing for 40 years. You got it down pretty good. But again, I am outside of the norm. I don't think there's many people my age doing that.
No,
I don't think there's many people 40 doing that, much less my age. But nonetheless, I'm an outlier, and medicine doesn't like outliers.
Exactly.
Yeah.
And not only does medicine not like outliers, medicine refuses to recognize that outliers are common.
Oh, yeah.
They want you to believe that outliers are rare. I mean, you actually describe yourself as being a rare case because you're right. Most people don't know how to lift 500 pounds. Because most people can lift half that amount. But in truth, most outlier situations have lots and lots of people in those outliers. For the very reason you were talking about earlier, that almost nobody is at the median.
Well, if I were to take 5 people just randomly and get their backgrounds, what they're into, look at their blood work, you can start to see a pattern of what's not norm. What is not the norm. And with my example of blood pressure, my entire life, 130/80, my entire life. So to all of a sudden start messing with that, when that's been perfect. Just mainly because they changed the idea of what low blood pressure was or high blood pressure was. It always seemed weird. Like, wait, it was fine before, but now it's not because you changed your measurement. Made no sense.
There's another thing that just occurred to me too, because I mentioned how I had been doing a little research to find out what are doctors scoring at for this kind of thing. And one of the things I looked into was blood pressure. I even asked my AI the question, what is the comparison between the average population? Oh, here we go again. The average population as a whole and doctors in terms of what their blood pressure levels are. And the first sentence that came back is that doctors' blood pressure is significantly lower than the overall population. I said, well, that's interesting. But then I kept reading. Significantly, in terms of the way the AI was written, was 6 points. In other words, the average systolic and diastolic pressure, for the average population was, I think, 124/79. I think that's what the average was. And for doctors, it was 118/75. Now, statistically, that's significant. Blood pressure wise, that's nothing.
No.
But it qualifies as a significant difference.
Well, it does. And again, a lot of doctors I know, they do medicate their blood pressure to make it match that. I've had this argument about cholesterol and blood pressure. We need recurring blood tests. We need to know. That's why keeping these records long term, so you understand what is your historical cholesterol. That matters.
Yeah.
The idea that I have very low cholesterol, and just genetically I come with a low cholesterol, and so I've always eaten a lot of cholesterol because I eat so many eggs, and my body needs cholesterol. I intentionally feed that, but my cholesterol levels have remained, some doctors say perfect, but it's like, okay, they're pretty low. But it's the idea of like, you don't need a statin. And then they say, well, your HDL is not where it needs to be. And I said, well, when you have low, it's about the percentage of HDL. So you get into all of these things, and it sounds like I'm being defensive when I'm talking to doctors, but if I've ever mentioned to you, I think you and I've talked about this. I have, since I've been a little boy, and I didn't know this for a long time. After getting recovery from my addiction, I hadn't been to the doctor in forever. And so I go see the doctor, and I've always been in perfect health. So I've never even considered myself having a health problem. So it's a pretty young doctor, and he He does the blood work, he does the urine test, and he comes back and he goes, "We have a problem." I was like, "Oh, I've never heard that in the medical context before." He goes, "You have blood in your urine." And I said, "I've never seen blood in my urine." He goes, "Well, no, you can't see it. It's microscopic." And I said, "Okay." I said, "So how much is no? Oh no, there's no normal blood in the urine. We gotta go do this test called the IBP where they put dye in you and they contrast." So that night I go home and I'm just convinced because he said, and of course he's another doctor. Said, "Well, it could be cancer causing it." Of course it
Of
could be.
course, yeah.
Yeah. And so, I'm worried to death. I don't sleep. I show up at the procedure at the hospital the next day. Uh, and then afterwards, the guy doing the procedure, the urologist, is an older doctor. And he said, "Look," he said, "less than 1% of the population has a thing called a microscopic hematuria." He said, "It's a tiny, tiny trace amount of blood, few cells of blood get there. We don't know the origins. It's just slipping through somewhere. It's compounded by your weightlifting." He said, this is nothing. You'll have this for the rest of your life. You probably had it your entire life." So that was a big relief. And again, I've never seen blood in my urine. It's just microscopic.
Sure.
So when I got home that evening, I happened to call my mom and said, "Yeah, the funniest thing happened." I told her a story. I wish she'd have called me. She said, "When you were 4 years old, we did the same thing.
Oh, wow.
We were scared to death something was wrong, and the doctor said the same thing. You're probably going to have it your entire life." I still have it. Every time I get blood, urine, give urine, I always tell them, "You're going to find microscopic blood in my urine. It's okay." And some younger doctors, "I've never seen that before." I said, "It's less than 1% of the people that have it. It's okay." But that's back to that bio individual concept, and that's what it's. You need to know that. In fact, I feel we have a responsibility, sort of the opposite of what your physical therapist was saying. Uh, I think we have a responsibility to be able to point out these nuances and this individuality.
Oh, yeah.
When I tell a doctor that my liver enzymes will appear to be high because I just got done lifting weights, I have blood in my urine. It's no need for concern. And my temperature usually runs about 97.1 between 9 and 97.5. So those are my norms. I'm letting you know that. And before we even do anything, so I don't have the panic running around, got to go to the hospital kind of thing. And it's just amazing that there's not more encouragement of just we need more of that. We need more people taking responsibility and not automatically being placed on these medications. If you need medications, you need them. But the idea that it's just always such a simple answer without the origins of why your blood pressure is up, very concerning.
Yeah, I totally agree with that. And I'll even go a step further. You are identifying a couple different ways that the science has kind of gotten swept aside. And I identify that in a couple of my examples as well. It's gotten to the point now where medical doctors who self-identify as scientists, because you study the sciences, particularly the biological sciences, in order to become a medical doctor, they've stopped being scientists. They've stopped behaving like a scientist. Is a very specific kind of being. A scientist is somebody who seeks data, accumulates it, creates a theory about it, and tests it by getting some more data to see if the data holds up, and goes through that cycle over and over again. That's a scientist.
Mhm.
Can we honestly say that medical doctors are doing that?
Well, I think they along the way were scientists, and then along the way you get stuck in your rut, and the idea that when you go to medical school, let's say you're starting medical school tomorrow, you graduate, been accepted, now you're going to medical school. So the information they're teaching you tomorrow, you're going to be in medical school for what, 4, 6 years, somewhere around there, whatever that is.
Mm-hmm.
And whatever they're teaching you tomorrow, the first class, the important stuff, we're getting the basics. 4, 5, 6 years from now, some of that information is going to be obsolete. It's just going to be, well, we found something different. You see that the idea that the concepts change and we get opinions that change. So medical school is necessary, obviously, to give a general concept of where we're going, but it doesn't always keep up. It's almost impossible to keep up. So The accepted, most doctors, again, I know in their field, they're good, caring. But they
Oh,
really, they really
I think
believe,
most people who go into medicine have the best of intentions. They
yeah,
really want
yeah,
to help people. I
yeah,
mean, there's no doubt in my mind about that.
yeah. Now, I also do know some doctors. I have a friend that is I don't even know his full title, but he is a micro neuro. He does brain surgery with lasers
Right.
on tiny little things in the middle of the brain.
Right.
This guy is constantly researching. He's constantly looking at brain scans.
Right.
He wrote books. He is like the guy that trains the neurosurgeons in the world. So
Right.
there's some guy, and he is constantly, he'll text me in the middle of the night, oh my God, you would believe what I found out today. I don't even know what he's talking about. It's way out of my league. He's talking about it. It's like, oh yeah. I write back, wow, I'm impressed, and I don't know what he means. Yeah.
And that's wonderful. That's fabulous.
Yeah. So just like we're saying, there's individuals with medicine that are sticking to that. There's also a lot of doctors that are accepting root cause diagnostics as a part of their practice, and those are thriving doctors usually because
Mhm.
the unfortunately the way medicine is set up, you have insurance is going to negotiate a fee with you,
Right.
and they're going to pay a fee, and usually you need to see 3 or 4 patients an hour is sort of how this is supposed to work. So you got 15 minutes with the patient. Now, an insurance needs a diagnosis to pay, so they're going to have to come up with something pretty simple, pretty quick. Whereas what I call root cause doctors are going to spend several hours getting to know you, looking at the blood test, getting fecal tests, getting urine tests, looking at the whole picture. There's going to be a lot of that, and that matters, but that's not cost efficient. So the cost of this root cause doctor, you're paying that out of your pocket. Insurance won't cover that often. So that's why it's a hard time that the doctor has to make a decision. The problem with medicine is doctors graduate with, a lot of them, hundreds of thousands of dollars worth of loans.
Oh yeah.
So and then a malpractice malpractice insurance can cost $250,000 to $500,000 a year.
Easily.
So you have $500,000 in student loans. You have $500,000 in malpractice, depending on how big your practice is. I mean, you get to a point where you got to make $700,000 to break even.
Yeah.
That's the system, and that's all part of it. It's just it's not the same as it used to be, unfortunately.
And as bad as the situation is with doctors, it's even worse with the insurers, as you pointed out.
Oh, yeah.
Insurers like to say that they insure based on science, but they really don't.
Oh no.
Like you said, they're insuring based on cost efficiency, which really has nothing to do with science at all.
Well, in mental health, one of my pet peeves, and I have a lot of pet peeves in mental health treatment.
I noticed that.
Yeah. So the insurance companies, every school in the country that trains therapists and social workers, they have a statement that you never diagnose your patients in the first session. You want to gather information. You can put your theories of what's going on, but you want to spend a little bit. You don't want to throw a diagnosis on someone day one without having all the information, because once you diagnose that, you sort of diagnose that. Insurance companies, for them to pay, we need a diagnosis. We're not paying to you. Session 1, we need a diagnosis. And so you're giving a diagnosis, so that now what they're going to get reimbursed for, okay, you're diagnosed with, acute depression. So we're going to say, we're going to give you 30 sessions with this therapist and the sessions have to be about the depression. And so they have to do case notes to match all that stuff. So you quit. In that case, we're only looking at depression. And then you're looking at all that. So now along the way, you may discover other things, but nonetheless, nobody's asking, have you had any concussions? Have you had strokes? Have you been sexually abused as a child? Have you been, what? There's not a lot of that gets up front. So we sort of get an idea like, oh yeah, here's our problem. And that's, again, insurance companies drive it now because they're so involved. It used to be that a doctor would say, okay, I had a session with this guy today. We're working on a diagnosis, that paying the doctor or whatever. Not anymore. I mean, it's all done on the computer. What's the diagnosis? And you can't click out of the screen to get reimbursed until you put a diagnostic code in there.
Yeah.
Period.
Yeah. That's a mess. That's a horrible
Yeah,
mess.
it is.
Well, we've been beaten up on the industry pretty good. But I think I want to get back to the original topic, which is who's in charge? Are we in charge? Is the doctor in charge? Is it a shared charge? How are we going to handle that? And I want to propose the idea that we need to get away from the idea that the doctor should be in charge. We even need to get away from the idea that it's a shared responsibility, because really only one person can be in charge of anything.
Right.
Which means it's got to be us in charge. Yes,
right.
we want to leverage the knowledge that comes from a doctor, but we have to be the ones who are in charge of our own medical diagnosis. That's my position. What do you think about that?
I completely agree. I think everybody should be their own case manager. I think you need to find the doctors, and if you look, you can find doctors that believe the way you believe. Find doctors that will agree to that concept. But and a lot of people, to be fair, are not. I'm not going to say capable. They don't believe the concept enough to do it themselves. I know when my dad, before he passed away, he was having some eye problems, and I have a really good friend. He lives in a small town. He lived in a small town called Plant City. It's about 20 miles from Tampa, in Florida. And so I have a friend. He's a pretty well-renowned ophthalmologist. He's on a 3-month wait. And my doctor, my dad's doctor, was a local guy, really nice guy that he always went to for his eye stuff over the years. So I heard that they didn't know why, but he didn't have vision in his right eye. And so I said, Dad, I would like for you to go see my friend. He's so-and-so. He's literally incredibly, he's had a lot better equipment. I'm trying to sell him on the concept. Dad's like, well, I don't like to drive all the way to Tampa. I said, I'll have a car take you. No, I'm just going to stick. So my dad turned down, and I'm not saying this is disrespecting his doctor, but an opportunity to see one of the, again, a world-renowned specialist, and he was going to see him the next day, not 3 months from now. He was going to see him. He said, you tell him to be in my office at 9 and I'll see him. And my dad refused to go. So my dad wasn't looking at that. He was. So a lot of people, maybe they can't, won't, or they're stuck on that old belief system. But wherever possible, you need to be your own case manager. You need to verify what your doctor says, and just be very aware in today's world of there's a bias in anybody's opinion, no matter what. But especially, a doctor will meet you as they did with you. They had a bias toward, okay, this dude's a little wacky. He's upset about 160 over 90. They probably chuckled about that, and so they gave you a hard time. Nobody ever said, wait a minute, you're normally 110 over 60 or whatever your number is. What? I wish somebody would ask the question, why? Yeah. Why? It not just, well, it happens. Yeah, what changed? And that's the key.
No, the answer I got instead was, well, our blood pressure bounces all over the place. Well, thank you. That was really helpful.
And it does. It does.
I'm not disagreeing with it. I'm just saying that's not getting at the issue.
Yeah. Well, and also the problem with blood pressure is if you're thinking about your blood pressure, you're affecting your blood pressure.
You are. Yes. I thought that.
Yeah. So I've always had this thing, I don't know why. I'm not nervous but you hear the white coat syndrome. My blood pressure is always high when I go to the doctor. It's always high.
Yeah.
Because I know they're going to tell me it's high. It's 130 over 80. But when I go, it'll measure it 150 over 100.
Yeah.
But at home on my blood pressure cuff and other people's blood pressure that aren't doctors, it's 130 over 80, 128 over 78. Always the same. But I just laughed now. I said, look, it's going to be this. You're going to want to give me medication. We're just not doing the dance. I'm fine. I part of my daily routine is I check my blood pressure every morning. In the mornings, in the mornings a little lower, of course, we're just waking up.
Right.
I'm 125 over 70 in the morning, and then midday when I get going. But if I'm too low, if I were where you're at normally, I mean, I'd be like, oh, I need a nap. I mean, that would be exhausting. I've just operated it. The bio-individuality of the body and the brain and all that together is lost in medicine today. And that's the big message, I think, of today's show is we need to, I hope, I hate setting people say that. I would really encourage people to become your own case manager. Study the things. We have access to all the information in the world. I agree. If you have chest pains, you probably don't need to dismiss it as heartburn. You probably need to go see a doctor. Yeah. If your lower right abdomen feels like you're about to just die, it's probably not good to say I pulled a muscle. You probably are having an appendix that's about to burst. Let's be real. Let's go do that. Yeah. Yeah. One of the things that one of my clients was telling me, he's a young man. His mother travels and his dad's not in the picture, and he's 18, and he's like, Joel, this is going to be a really bad question. He's like, you're probably going to disagree. He said, but I'm going to go see a doctor, and I've never gone to the doctor by myself. Can you go with me? He said, because they always intimidate me. And I said, yeah, I'll go with you. I mean, it was one of those things, sure, I'll do it. So I went, and he was talking, and the guy said, well, I'm diagnosing him, and he was telling what his complaints were, and he goes, he's like, sometimes I get the kid has young man has anxiety, and he feels it in his stomach, right? And so the doctor's like, well, I think we need to test the gallbladder, and the guy's like, he said, well, actually, when I injured my gallbladder, I had it taken out when I was 14.
Oh.
And he goes, oh, well, I still think we need to test that area. It's like,
oh, jeez.
Well, there's really, you want to scan the area where it hurt. I said, could it, and of course I interjected and I said, doctor, could this be anxiety possibly? He goes, well, maybe. I go, can I be a little more, but can we say it is anxiety? Because it is anxiety here, and I don't want him on benzos, but you need to not be looking for a gallbladder problem in a young man that doesn't have a gallbladder.
Yeah,
Let's start with that. It's just bizarre stuff,
Yeah, absolutely. One other last point I wanted to leave. I love what you were saying about how we need to be our own case managers. I would actually take that a step further and say we already are, including your father, by the way. Your father was his own case manager. He was taking an action you didn't like, but he was managing it the way he wanted to manage it.
Well, and there's also, when I came to the conclusion where I corrected myself, because I was really pissed at him for not taking advantage of this opportunity. But a factor that my friend, the doctor, told me, he said, Joel, he said, there's great value in him being comfortable in his hometown with the same doctor he's always seen. He said, you're discounting that. He said, I feel that, I'm sure he said, I don't know the man, but I'm sure he's a good doctor. I just have access to so much more than this guy could possibly have. But you're discounting your dad. So that is a perfect point, because my dad's decision to do that was him being his case manager based on his well-being and what he wanted to do. And my dad's concept was, he was a nervous wreck when he went to Tampa. And in my mind, it's a 20-minute drive. It's just whatever. But in his mind, Tampa was this gigantic place with all this craziness. Yeah. And he's in a town of 25,000. He knows everybody.
Right.
He just was comfortable there. There's value in that. And when I was talking to my dad about it, I said, Dad, I said, this guy, and he goes, I'm not going to live forever. It's okay. He was at a point like, I am much more about being, and I let it go and understood. It's just, that's what he wants.
That is a key portion of it right there.
Absolutely.
How often we talked about it here on the show when we're talking about law of attraction, we create our own lives. That's an example of creating your own life and living it the way you're choosing to create it.
Yeah, yeah, and and there is also a danger in. I know people that get stuck in diagnostic dives on YouTube, and
Mm-hmm.
they'll go forever, or Google and AI, and they'll, if you say, what are, I have a really bad headache. What is the cause? Well, one of the causes that's going to pop up is a brain tumor. I promise you,
Oh,
it's what's
sure.
going to
Yeah, that's
pop
an
up.
option.
Yeah,
Yeah.
yeah, and so where we're in danger of using sort of that energy when you really are convincing yourself have a brain tumor, your body will respond as if you're having a brain tumor often.
Yeah.
So you gotta weigh all this. But at the end of the
Totally.
day, yeah, we really need to advocate the way you advocate for yourself, advocate for your children, advocate for your parents if you're in that. But you want to use a combination of stuff out there, but you also want to take it because you go see a doctor. We have a tendency to say they're infallible, and they don't make
And
mistakes. And
nobody is infallible.
yeah, and that's the idea. And they'll miss things. It's just not negative against it. It is not the easy way every time. They're always looking for the easiest answer possible, which I
Mhm.
get. But it's like when somebody has a recurring uh, infection, let's say a recurring ear infections over and over and over. Kids have this a lot of times. Okay, we're on our ninth round of antibiotics in 2 years, so that's
Mm.
not good for the body. So
Right.
why is this kid having these ear infections over and over again? What's
Yeah.
going on? Are we not killing you with the right antibiotic? Is there like hidden strep? Is it we need to go further than here's your ninth round of antibiotics when you're 12 years old.
Yeah.
It's not good for the body.
Because when you don't learn from the data, you're not practicing science.
Yeah, yeah, and so there's a lot to do, and because of the monetary implications and the way insurance has been set up, I would love to tell you we're on a path for it to get better and fix itself. You got to become. We need to be more of an advocate for ourselves because it's not. Our knowledge is getting better. In general stuff, we're always making new discoveries. But the implementation of that based on your individual situation is going to be crucial, not based on the median of the entire population.
No, I think it's a good way to wrap up the conversation. So yeah, good. That was really, really good. So thank you very much for a really interesting conversation. We always have these really cool conversations, but today was particularly interesting. I really
Sure.
appreciate
Thanks,
it.
Walt. It was really good.
Yeah. And thank you to our podcast listeners everywhere. We'll see you all next time here on LOA Today. Goodbye, everybody.